I'm John Billings. I'm a professor of health policy and management at the Wagner School. I've been here a little more than 20 years. I do a lot of research on the problems and needs of vulnerable populations, meaning uninsured patients, Medicaid patients, low-income patients, minorities. My teaching focuses on what the current issues are facing the healthcare delivery system for everybody, mostly domestically focused, but I do a lot of work in the United Kingdom as well. The project was called PAR, Patients at Risk of Re-Hospitalization. This is a project that was several years ago that I did for the National Health Service in England. In healthcare, there's something called the 80-20 rule, which is 80% of all costs are driven by about 20% of patients. Well, the idea of the project there was to see if we could identify, using historical data, who was most at risk of having a future hospitalization, because then you could intervene with them and try to prevent that hospitalization. So we did a predictive model using prior information about hospitalizations for the last 5 years, and then applied it in real time to see whether it could have an impact on patients. And the model ended up having a very high predictive value. We were right about 2/3 of the time about who was going to get admitted. And then the National Health Service set up a bunch of programs, several programs, to intervene with those patients and try to prevent future hospital admissions by giving them better care in the community. The reason we focus on hospitalizations is a lot of them are preventable. And when you have that event happening, it's a really high cost event. So hospital admission is $15,000 to $20,000. So if you can knock out one of those, you can invest a lot of money in a program that's designed to give them better care coordination. My whole career has been public service. I'm a lawyer by training. My first job was a legal services lawyer representing low-income people with their civil problems. I ran a juvenile justice system. I was a president of a major national health foundation that had been here. So I've never been in the private sector. I've always been involved with something to do with public service.